Okay, we're back. Senate Health and Welfare, February 23rd. And committee, unfortunately, our ledge council for our next group of topics, our ledge council not available until a little after 11 o'clock. So what I'd like to do for a couple of minutes is to clarify folks we would like to have in on the bills that we've just looked at, and then we'll take another break. And I know that everyone can use it. It's that time of year. Although I hate to take the break from the work that we need to do. So in looking at S285, I want to clarify and make sure that I have the list that we'd like to hear from, the folks we'd like to hear from. So I've got Green Mountain Care Board, the home health folks, probably Jill Olson, Ina, the healthcare reform director, and then the healthcare advocate we could invite in as well. Is there anyone else that you were thinking about? I will share with you this also. I have one more thing to share, but is there anyone else on that list? I think we'll be good. We've taken so much testimony on this. We'll get to some. It'll be good to hear some specific feedback. The other thing is, in talking with the consultant for the task force on access and affordability, his suggestion was that we include the reference to the social determinants of health within the IT section, so that we can have a more global perspective on healthcare improvement. So Joshua is putting together some language for Jen that we can look at when the next time we look at the bill. So just wanted to give you the heads up on that. And so that's S285. I know there's going to be a lot of interest in this, or lack thereof, or concerns, but we've gotten at a stage where it's time to move forward. On the other question I have for you is, we're talking about S197 on the tiered approach to kids' mental health within after school program. There were questions about who we should hear from, and we'll get some comments from the Department of Mental Health and from our DAs, perhaps through the Vermont Care Partners. I have had further conversation with Senator Campion, and he's going to pick up the agency of education piece. So it'll become what we like to call a holistic bill. And as we get more information, Cheryl and I and Senator Hooker and Senator Terenzini and I will all be sensitive to this in the Education Committee, and ask some of the questions that have been asked here, so we know that we're not taking too big a step. We're not requiring too much in the grants process. I think that was a concern. So maybe there's some language change that could be made there. I do think that might be a possibility to simplify that language a little bit. So I'll look at that with maybe with the after school folks, or in the Department of Mental Health in particular, and we'll try to get them in.
Senator Lyons,
Yes.
I know that there's concern about, where this money should be spent, and, are we spending it in the best possible place? But listening to Holly Morehouse about the tiered approach, that where this type of resource would help not just kids who are in crisis, but all kids, because this is, especially during the pandemic, I don't know that we all realize how the pandemic has affected us. And it seems that, this kind of service could provide opportunities for kids to talk about their issues that they've really never really thought about. So,
Right.
as much as,
Good point.
you know, just wanting to make sure that money is used appropriately, but I think that this lends itself to the appropriateness of that funding.
Yeah, well, we'll see a lot of the decision making about the use of the money will fall to the Agency of Education and their interpretation of ESSER guidelines. So, you know, we have no idea what will happen. I would certainly hope that it won't completely be left in the dust, because we cannot leave our kids in the dust. I agree with you about your comments on the tiered approach. Thank you. All right. Okay, so as you look forward to our ahead, may not look forward to it, but as you look ahead to our schedule, in particular, tomorrow's a very heavy day of testimony. But on Friday, I've tried to put in some bills that I put in again S285, and hopefully we'll be able to go through that with some recommendations. If there are comments that Green Mountain Care Board or the home health folks or others who are on our list can make on Friday, we will put those in. Aaron will reach out to those folks. I'll talk with him about doing that. We will modify the agenda on Friday, because the bills that are there right now are new bills to us, or prescription drug bills. Some of them are very important, but that we would like to finish our work on some of our other things. So we look for change on Friday, and it would be an update of testimony to the bills that we have in front of us. The other thing I would ask you is that as we come in early, 8:30, tomorrow is a bill that we looked at once. Senator Hooker has brought to us the Medicare supplemental insurance. We also have comments from Blue Cross and Blue Shield on that bill, and Aaron will post that for us on our webpage, so we'll see that. And then when we come in at 8:30 on Friday for the ALS bill, it would be really helpful to have a fuller discussion on that bill and what your thinking is. We're going to look at it a little bit today, but I'm not under any illusion that we'll be able to complete the work on that bill this week, but if we can make some progress, that would be helpful. So, okay.
Are we going to come back to the what is it, S72 after break?
Yeah, I think we will, and it will. I think that's where we'll look at it. I'm thinking that's probably the best time we can have a discussion. Depends on what our work on Friday looks like, but we can always have a conversation about that on Friday.
Okay, because it
But
does
we'll come
seem
back
like,
to it.
based on what we heard this morning anyway, it seems like something we should do. But I would like to, even though it's really long, I'd like to have Ledge Council walk.
Oh, yeah, we
through
can't,
language
yeah,
for
we
that.
can't act on it until we've done that. And so it'll be a matter of when Michelle Childs is available. Yeah.
And
Yeah. I agree with you. I think that this one has to go forward. It sounds like a lot of people are working on it, everyone from the judiciary to DCF. Okay,
okay.
go ahead,
Just
Senator.
a question on 239, the Medicare supplemental insurance policies. Did Aaron get in touch with Elizabeth Lively? She was wishing to be a witness for that as well.
Aaron,
Yes, she is sending someone in her place.
Oh, okay. Thank you. I
Yeah, that's
see. Is that?
the chief executive of dialysis patients.
Oh, right. There you go. Thank you.
okay. All right, good. Okay, I think unless there are other questions or comments, I mean, we have looked at a number of bills. S244, which was the primary care bill. We may come back to, we've taken some of the information that was in that bill, I think may be captured in the work we're doing on 285. So we'll look at that bill. Take a look at the bills that we have had before us. There is one bill that we looked at a bit ago, which was a suicide prevention bill, S69. And there's a group of folks who are ready to testify on that bill. It is another appropriation. I know that there's money in the governor's budget. I think, I should say, I think there's money in the governor's budget for that bill. So we'll take it up and we'll look at it, and I think there are some good policy pieces in there, and we may want to just take a look at that bill after a crossover. So what I will do is I'll send another email out with a list of some of the bills that we may want to consider as we get to March 11th. We know where we are with most stuff, and then another on the other S158, of course, I'm in contact with Senator White, and we'll see what transpires. Okay, so committee, thank you for your patience, and let's take a break until 11:10. And if you notice that Katie McClinn is here, we'll start earlier, but 11:10.